each time the attendance got bigger and bigger. And what you're hearing also from the individuals who came to the town halls often reflected then of where leadership here in Washington was in many respects calling into question their motivation for being at these town halls. They were quite resentful of the name calling, etc. So that I think spawned some of this. But I think overwhelmingly there were a couple of different things. First, everybody has their own story that the cost of healthcare is too high, and they do want to fix the problems for the woman with breast cancer who is denied coverage, denied treatment, etc. Americans are overwhelmingly fair and want justice for people. And on the other hand, they also resent, you can't give it for free. Everybody ought to be paying something, and certainly they don't want to be providing the care to illegal aliens. So I think those were kind of themes throughout that. I would add also the senior citizens, some discussion about Medicare, some questions about Medicare, but overwhelmingly the concern for their children and grandchildren, that somehow not everything can be true of what they're being told. You can't, it's their own common sense that is telling them, look, the deficit is already X, you want to make the deficit even more, yet you also are going to make this free, and how do these all add up together? That just cannot possibly be true. Also comments from individuals who identified themselves, who said they had voted for the president or had been lifelong Democrats. But the questions in their eyes, really in many respects, why are they doing this? Was a common theme also. Why is the federal government really trying to take over in such a top-down, power comes from the top-down mentality? And again, average American out there saying that's not true. The power comes from us, and they just shouldn't be doing this to us.